Great, good morning everyone. With nearly 38 years of policing experience, whether it was working the front lines and on the streets, or when I was assigned to the major drug squad for a period of years, right up to when I was chief of police for the last 5.5 years, there has been one consistent theme that has been pretty dominant throughout our communities year after year, and that discussion has been on drug and substance dependency. And in fact, to get today, as we move to today, it's an even broader and louder discussion, because what we're seeing is right across the city, right across our cities, right across our neighborhoods, even on TTC property, we are seeing that this issue has magnified, it has not decreased. In fact, about a month ago, my wife and I were talking to one of our sons who was on a bus, and right on the bus, somebody came on and started to light up a meth pipe. So this is the kind of disorder that we're having. Our city's moving in the wrong direction, and it's impacting absolutely everybody. Whether it's people that are dying as a result of it, whether it's a mom, father, or son picking up needles in the park, or whether or not in some neighborhoods people have naloxone kits at their front door. Over the last 3 years, when we talk about drug overdoses, it has skyrocketed compared to the 3 years prior to that. If we look at a time frame between October of 2021 and September of 2022, 500 overdose deaths have been recorded. And they're not just numbers. They're mothers, their fathers, aunts, uncles, their sons and daughters. One of the things that we need to do, and one of the things that I will do as mayor, is I will immediately call on council to stop the irresponsible decision of requesting the federal government decriminalize all drugs, especially when we're talking about our youth, our people between the ages in 12 to 17. It's like we're giving up, and we can't give up. We can do so much better as a city. That's why, as mayor, I want to introduce a comprehensive and compassionate plan that will have holistic solutions, not just solutions that look at it from the direction it's going in now. So first, one of the things I'll do is I will revise the Toronto Overdose Action Plan to focus on treatment and recovery and make sure that we utilize fundings in those capacities versus just the supervised sites. Next, I'll set up a working group and service providers and experts to develop strategies to support treatment and recovery as a priority. Third, I'll work with the province to create a more inpatient option for those in need of treatment. Options like 24/7 emergency intakes, referrals to community health providers, and connection to care teams such as social workers and other staffs that'll be necessary. And fourth, since Toronto is the epicenter for this particular situation, it's important that we have federal and provincial involvement to make sure that we can get the right numbers of beds and staff in accordance to help resolve this problem. Enough is enough. We have to make sure that we do everything we possibly can for some of our most vulnerable members of our community, and we have to do it the right way. And that's why, as mayor, with my experience, I believe that I can move this discussion and this issue in the right direction to a much more improved, healthy, vibrant city, a city that we all can move forward in, that can be prosperous and provide the opportunities for so many of us to live the Canadian dream. And having said that, I'll take some questions.